Bueno, entonces vamos a darle paso al doctor Ethan Russo. Please, doctor, can you share your screen, please?
Sí. Bueno.
Doctor, how about your Spanish?
Hablo poquito, pero no puedo hacer la presentación
Okay.
en español, desgraciadamente.
Tranquilo que usted va a tener un traductor. Entonces, le pedimos a todos los participantes que abajo, en donde dice interpretación, donde sale un mundito, elijan la opción para español o para portugués. ¿Ok?
Bueno.
Para que el doctor pueda empezar con su conferencia. So, Dr. Russo, thank you very, very much for being with us today. It's a honor for me as a president of associations to have your support, and as a person, one of the most important days of my life. Thank you very much for being an honorary member of our associations, and I look forward to collaborating with you in the future, please.
Yes.
So, doctor, please give us all your knowledge, all your experience, and all your love for the plant in this moment. Welcome.
Muchas gracias. Es un honor para mí también. On this first page, you will see my email. I would be happy to hear from any of the participants with questions. Also, all of my articles are posted online for your access at ethanrusso.org, ethanrusso.org, so you can have access there. Let's see. This is not advanced. Oh, I see. Okay. Sorry, I need to use a different, there we go. It's important that you know that I come from a family of veterinarians. This is a picture of my father and my brother in 1953. My father tried to work at age 93 until 10 days before he died. And my brother, who is now 72, is still a veterinarian. So I see that you already have had a lot of background, but I'm going to present some history and background that I hope is different than what you've had. This is looking at different phyla of the animal kingdom and where we see the endocannabinoid system. And basically, it is in all vertebrates and even down to some phyla that just have a notochord. But certainly all mammals, birds, reptiles, etc. However, there are none in the insects. They have no endocannabinoid system. I like to say this is why insects have no sense of humor. In fact, many of the defenses, the acid cannabinoids in the plant, are insecticidal. Cannabis has an extremely long history in veterinary use. This is just a picture I used to show the love for cattle. But in India, it was used in veterinary medicine from at least the 12th century, as documented in subsequent writings. To this day, it's still utilized to treat diarrhea in animals such as this, for parasites, worms, and for footsore disease, to increase the flow of milk in cows and to calm them. And also to improve the work ability of animals. Historically, from the ancient Greek, it was noted the virtues of hemp. And something they noticed was when it was put in water, it would cause it to gel. And it was also used to treat diarrhea in working animals. Later in Europe, from France in the 16th century, it was talked about how fresh hemp, which probably would have been cannabidiolic acid, could kill certain kinds of bugs. And it was again noted after some 1,500 years, the same claim that this water was good for colic in horses, also for shortness of breath. The real scientific investigation of cannabis really began about 1839 when Sir William O'Shaughnessy, who was an Irish physician, went to India. He studied the work of the Ayurvedic physicians there and did experimentation with cannabis, initially in animals and then in his patients. He was able to show that there was appetite stimulation, that there was a sedative effect where needed. And particularly with respect to animals, he did work on many different species. So the carnivorous animals, fish, dogs, cats, swine, vultures, crows, and humans showed intoxication at high levels of use. But the grazing animals that eat grass, the horse, deer, monkey, goat, sheep, and cow, were not really affected at the kinds of doses that he administered. It may be news to some people that before prohibition of cannabis, it was used extensively in veterinary medicine. And I've had access to many of the books and articles from the 19th and early 20th century to document this. As we've seen from O'Shaughnessy, it was used as a sedative to stimulate appetite. It was used as a treatment for tetanus in animals, as well as people, as an anticonvulsant and to treat rheumatic problems. After O'Shaughnessy went back to England to lecture, Lay in 1843 was the first to report benefit in treating tetanus in horses. Also, he found that it was an effective antidote to strychnine poisoning. Subsequently in France, was used to treat chancres in ears of dogs as a purgative in cattle. From Italy, it was used for colic and urinary pain. In Scotland, as an analgesic, an aid to sleep, and as an antispasmodic agent, and was felt to be equally beneficial to opiates. From South Africa, it was used for bowel inflammation, cough in horses, and canine chorea, and we'll come back to that one. In England, used for asthma, convulsions, cough, cystitis, and tetanus. And again, this is all veterinary uses, not extrapolating from human use. In the United States, at the end of the 19th century, again for tetanus, cystitis, and for a term I wasn't familiar with, azoturia, that I gather is equine exertional rhabdomyolysis. So this similarly might be useful for other causes of muscle breakdown. From the 20th century, Muir used it extensively in the US as a sedative in horses, painkiller in horses, and antispasmodic. In 1901, there was a 50% survival in animals treated for tetanus. It was noted subsequently that this had a narcotic effect without constipation and advantage over opioids. Then on the psychiatric side, to treat equine melancholia with pneumonia, externally as a liniment, used for spasms, for hobbling horses, and subsequently in delirium associated with apoplexy of birth, and also for volvulus and enteritis. Going back to human use, Dominic Corrigan in Ireland described successful treatment of several cases of Sydenham's chorea which we now know is a movement disorder associated with post-streptococcal autoimmune reactions. Normally, this is felt to be chronic or permanent, and he successfully treated a child over the course of a few weeks. And this has a parallel to Gresswell, where he noted in Korea, in dogs, the tincture or extract is useful in allaying the spasm. We know that the basal ganglia of the brain are very richly endowed with cannabinoid receptors, and so this is, again, useful information. Muir noted extensive experiments with cannabis in horses, feeling it to be a safe agent for sedation, pain killing, and he established dose ranges in horse and dog that might be useful to look back at today, although we can't be sure of the potency of the preparations they were using at that time. Now we're going to have a series of pictures of old medicines that were used in veterinary medicine. And as you see here, this carminative drench for horses, its primary ingredient was cannabis, also with capsicum, chiles, and salicylic acid. But the primary ingredient was cannabis. There were a large series of medicines used to treat colic in horses and cattle. We see an example here. Alcohol, chlorohydrate, and cannabis. This is Raleigh's colic and bloat compound for horses and cattle. This was on the market for some decades. My friend Donald Wirtschafter has a great collection of these bottles. There were also patent medicines for dogs, especially to treat cough, cold, and distemper. And these were expensive. $1 in 1906 would be 28 US today. And what they said was, we'll relieve the worst cough, chill, or fever, influenza, or mucous membrane infections of the animal's throat, nose, eyes, mouth, or air passages. And traditionally, hemp seed has been used as a fish bait, and this is true today, where it's still used in Japan. Going a little later in the 20th century, this is a photo of Robert Walton, who was the dean of the Department of Pharmacology at the University of South Carolina. He wrote a book in 1938, which was the best review of cannabis in the early part of the 20th century. And he did extensive work using test animals, in this instance, dogs. And he showed a sequence at different doses of what happened to a dog that was exposed to cannabis. A, normal, and B, he notes a progressive ataxia as the dog becomes unable to stand steadily on its feet with a higher dose, and ultimately will pitch backwards and engage in some scratching movements. At this point in the early 20th century, when they didn't have biochemical analyses and hadn't identified tetrahydrocannabinol, dogs were used to test the potency of medicines that were made by the various pharmaceutical companies. And there's a reason for this ataxia that's demonstrated here many decades later. Herkenham examined various species and the density of CB1 receptors in the brain in various areas. They used tritiated CP 55940, which is a high potency full agonist at the CB1 receptor. As you'll see here, in the dog, we have a very dense CB1 activity as compared to the human, which is much less. And so this is why dogs are particularly sensitive to ataxia from doses of THC that are too high. Now, we're going to get into a section that I'm sure is a little bit of review, but we'll just go through it. Cannabis sativa means cultivated cannabis, and the cannabinoids and terpenoids are produced in these glandular trichomes. These are the molecules. It is the case that THC and the endocannabinoids, anandamide and 2-arachidonyl glycerol, are both weak partial agonists at the CB1 receptor. It may be that 2-AG is a full agonist, however. We have a concept of endocannabinoid tone. That's a function of the levels of the endocannabinoids, the status of the receptors, whether they're active or inactive, and the enzymes that synthesize them and break them down. There are 3 varieties of cannabinoids. The phytocannabinoids are plant-derived. For the most part, we only see these in cannabis, although cannabigerol and cannabigerolic acid have been isolated from a South African plant, Helichrysum umbraculagerum. The endocannabinoids, anandamide and 2-AG, Professor DiMarzo described their role as relax, eat, sleep, forget, and protect. And there are also synthetic cannabinoids that may have a very different structure, but also work on cannabinoid receptors. These are just diagrams of how they work. The endocannabinoid system, generally speaking, these are produced on demand in the postsynaptic neuron and travel in a retrograde fashion to the CB1 receptor on the presynaptic neuron, where they inhibit the release of neurotransmitters. So if it's a stimulatory glutamatergic neuron, we reduce the stimulation. If this were GABA, we inhibit the inhibition, and it's a net stimulatory effect. This just shows different CB1 expression in the brain. As we've seen, very high expression in the cerebellum, particularly in dogs. Also in areas subserving pain, nociceptive areas, the limbic system, basal ganglia, and reward pathways. And in animals as well as humans, there's very little in the lower brainstem and the respiratory centers, so there's no respiratory depression, no matter how high the dose of a cannabinoid is. There is a good expression in the periaqueductal gray matter, which is important in pain control. And out in the body, very active in the enteric nervous system and the gut, where it modulates propulsion and secretion, and out in the limbs for pain and itch. CB2, of course, is a non-psychoactive receptor important in immune modulation and inflammation and pain. There are many companies that are interested in producing CB2 agonists that wouldn't produce intoxication, but still have beneficial effects. It's important to know that caryophyllene, a terpenoid in cannabis, is a moderately high affinity CB2 agonist with no CB1 stimulation. Professor Mechoulam and Packer have noted the effects of CB2 on all of these different tissues, particularly relating to inflammation and fibrosis. And as we've heard previously, both CB1 and CB2 receptors in the skin, where they exert anti-inflammatory and you get a bacteriostatic effect from the cannabinoids. Cannabidiol is also a TRPV4 agonist that reduces the production of sebum, would treat acne in humans. Again, looking at different organs, this fellow doesn't seem to have bones or heart, but we have the endocannabinoid system there as well. And recently, cannabidiol was shown to stimulate bone fracture healing, and this certainly could be used in veterinary medicine as an adjunct to other treatment. Just a picture of the plant indicating its role for food, fuel, fiber, and pharmaceutical uses. You probably have heard a great deal about THC and CBD already. I did want to address a couple of things about cannabidiol. Cannabidiol is an extremely versatile medicine with perhaps 30 mechanisms of action, but it is not particularly potent. Many companies will say that they have a small amount and expect that to do something, but generally higher doses are needed. It is a misconception that cannabidiol is sedating. The confusion comes about because most types of cannabis that are high in CBD are also high in myrcene, which has a sedative effect. At low and moderate doses, cannabidiol is actually alerting. There also have been claims that that CBD converts to THC in the body after exposure to gastric acid. There's no evidence that this occurs in humans. Cannabinoids don't remain in the stomach. Recently in Brazil, it was noted in several hundred patients with doses of hundreds of milligrams of CBD, there was no conversion to THC. We've become more interested in time in the cannabinoid acids. So this would be what's in the fresh plant before decarboxylation. And this relates to two recent findings. THCA is anti-inflammatory via activity at tumor necrosis factor alpha. So it has an inhibitory effect there and should be useful for a variety of autoimmune conditions, including rheumatic diseases and inflammatory bowel conditions. In Spain, it was also shown, excuse me, that it's a PPAR gamma agonist. So that's a nuclear receptor that affects gene transcription, which should make it important in metabolic syndrome, to treat obesity, also as a possible agent to treat cancer. Instead of CBD, the fresh hemp has cannabidiolic acid. This is a natural herbicide. This will produce some COX inhibition at very high doses, but high doses should not be necessary since this is between 100 and 1,000 times more powerful as an antiemetic to treat nausea and vomiting. And that seems to be through a mechanism mediated by the serotonin 1A receptor. Historical data would indicate that cannabidiolic acid should be useful in treating tumors. We'll often hear that can't make a plant medicine that can be approved by regulatory agencies such as the Food and Drug Administration, but in fact, there is a blueprint for doing this, and the same steps are required. It's important to prove safety, efficacy, and consistency. For a botanical agent, this may mean demonstrating the identity of several hundred peaks in a biochemical fingerprint, but this has been done for Epidiolex and for Sativex in 30 countries and could be done for other cannabis-based medicines for veterinary use. Just to demonstrate this, this is 25 batches of nabiximols or Sativex over 9 years, and the variance is so little that this looks like single peaks of the various agents. And in actuality, 91% of the peaks were identified. And so that's the kind of benchmark that's necessary to get at least FDA approval in the United States. 3 years ago, the National Academies of Sciences, Engineering, and Medicine came out with a report on cannabis and its benefits and its problems. Their data cutoff was in 2016, so it really didn't have the latest information on the use of cannabidiol in epilepsy. A couple of years later, my colleague Caroline McCollum and I wrote an article about cannabis administration and dosing in humans, because at the time there had never been a peer-reviewed journal article that addressed this topic. And we used information from the GW Pharmaceuticals development programs, as well as our personal experience and that of our colleagues. We had a different table of levels of evidence for cannabis-based medicines in humans. So there is conclusive or substantial evidence of efficacy in chronic pain treatment, multiple sclerosis spasticity symptoms. There's approval of Sativex in 30 countries for that. Treating chemotherapy-induced nausea and vomiting, of course, and treatment of intractable seizures and Dravet and Lennox-Gastaut syndromes. Just this past year, seizures associated with tuberous sclerosis were added. There have been many studies showing benefit on sleep disturbance due to pain or a variety of other conditions. There's been a past history of demonstration of benefit in glaucoma, but no recent work has been done. We have anecdotal information on treating symptoms of dementia, particularly agitation, and improving sleep. There now have been 2 phase 2 clinical trials showing benefit of cannabidiol in schizophrenia. And then you see the rest of the list, particularly primary treatment of cancer, which really hasn't gone through any clinical trials as yet. In terms of side effects, I think these are going to be familiar to everyone. Of course, most common are CNS side effects, drowsiness, dizziness in humans, dry mouth. Smoking causes cough, phlegm, and bronchitis. None of your patients are going to be doing that. Of course, anxiety due to THC excess. And then the more severe things come about only with overdoses: orthostatic hypotension, toxic psychosis, etc. In humans, we can say certain things, that 2.5 milligrams of THC is a threshold dose, 5 milligrams is usually enough and is tolerated, but 10 is too much unless the patient has prior tolerance. Important even in veterinary medicine would be at the bottom. The correct dose is the lowest that produces a therapeutic effect without associated adverse events. And again, in dogs in particular, you will certainly know when there's too much THC because of the development of static ataxia. Now, we'll go through some special cases. And again, these apply to humans, but should be quite applicable to treatment of animals as well. Cannabis is not a good medicine for acute pain. And so, might be useful in a post-operative situation, but only in conjunction with opioids. In contrast, it's very effective in any kind of chronic pain, whether somatic or especially neuropathic, areas where opioids are less effective, particularly in chronic use. The best documentation in treating pain is for type 2 preparations. That means equal amounts of THC and CBD, or at least a combination of those two medicines. There have been a wide variety of randomized controlled trials of Sativex in pain. There's been a limited amount with smoked cannabis in humans, but extensive use of this particular agent. And that is a one-to-one preparation of THC and CBD. So it should be illustrative of the benefits. And so this is in various kinds of neuropathic pain, cancer pain, etc. On sleep, this is an old study we published clear back in 2007, but in almost every case, whether it be multiple sclerosis, treatment of pain, treatment of rheumatic diseases, there was a statistically significant improvement in sleep. And I suspect the same would be true in animals. These are various studies in spasticity associated with multiple sclerosis, but these would be applicable to spinal injury or other causes of spasticity. How does this work? Well, muscle tone is under tonic control of the endocannabinoid system. So agents like THC, CB1 agonists reduce spasticity, and drugs that would reduce endocannabinoid tone will make tone worse. So we've mentioned CB1 receptors are densely packed in various motor control areas and in the cerebellum, also in the interneurons of the spinal cord that mediate tone. As we've seen, there are many studies showing benefit in spasticity in humans. Looking at side effects, these are two sets of studies. The red were early studies where very high doses of Sativex were allowed. And the blue is a final study that had actually more patients with a lower dose cap and a slow titration. I'm sorry, the blue is prior studies. The red is the pivotal study, the later study. So we see side effects like dizziness, fatigue, somnolence, nausea, etc., all being cut substantially by using low doses to start and a slow increase in dosing. And as it says, most adverse events are early and transient. I understand you've already had some information on epilepsy. It's important to note THC can be proconvulsant in rodents, but only at extreme doses. This has never been shown in humans. And really, I doubt that there is any reasonable dose of THC in dogs or other veterinary animals where this would be a problem. Cannabidiol is anticonvulsant, but there are also other agents in cannabis that have anticonvulsant effects, including tetrahydrocannabivarin, linalool, which is a terpenoid, and likely tetrahydrocannabinolic acid. Now that doesn't cross the brain barrier, but in severe epilepsy, there's breakdown of the blood-brain barrier, and this may be applicable because many of my colleagues use this in very low doses to effectively treat children with epilepsy. Cannabidiol is approved as Epidiolex, which is 97% pure CBD, but as an isolated agent, very high doses, 20 milligrams per kilogram per day in humans were needed. And it's been observed, particularly by Pamplona meta-analysis, that efficacy was similar with doses of CBD that were about 20% of the high dosing when other components were present. So it may be that mixed preparations are going to be best in treating epilepsy. And this is just a study in humans by Davinsky et al. Using cannabidiol 20 milligrams per day versus placebo. There was a marked decrease in seizure frequency as compared to placebo. There was a substantial reduction in seizures, 50% having, 43% of cannabidiol patients had at least a 50% reduction, only 27% in placebo. And some small percentage became seizure-free. These are patients that were previously intractable with the Dravet syndrome. Cancer. Now, in terms of symptomatic treatment, of course, there's benefit of the cannabinoids in treating nausea and vomiting associated with chemotherapy or radiation. There were 2 positive phase 2 randomized control trials in opioid-resistant pain using Sativex. Unfortunately, the phase 3 studies were not quite acceptable. In terms of primary treatment of cancer, various cannabinoids, particularly CBD and CBG, cannabigerol, are cytotoxic for cancer cells and promote apoptosis, but they're protective for normal cells. In humans, generally large doses are required, but that's not true with all brain tumors, as we'll see. Sativex, in a dose of about 32.4 milligrams of THC a day with 30 milligrams of CBD, showed significant benefit. Now, the study hasn't been published because there's still some survivors. Of course, glioblastoma multiforme is the most severe brain tumor in humans. This was used with temozolomide, and there was an 83% 1-year survival as compared to 53% in controls. And again, there's still some survivors, although this was done several years ago. Although dogs don't get Alzheimer's disease, certainly dogs get dementia. And so this is worth mentioning. In treatment of agitation, there are various cannabis components, THC, CBD, and linalool that can be useful. Pretty much the same for anxiety. For crazy behavior, CBD is of benefit. For sleep, many agents. THC will help stimulate appetite. THC, CBD, and linalool could be good for aggression. And actually directly affecting memory would be alpha-pinene, an acetylcholinesterase inhibitor that will boost levels of acetylcholine in the brain. And it's possible that CBD and THC exert a neuroprotective effect in dementia and other neurodegenerative diseases. Again, although dogs don't get schizophrenia, they could have crazy behavior. CBD in high doses, 800 to 1,000 milligrams a day in humans, show benefit on both positive and negative symptoms of schizophrenia. And I believe that is the end. I hope I haven't gone too long on the time. Let's escape here.
Okay, Dr. Russo, very thank you. Really inspired your presentation today. I hope we count with your presence in future events of the associations. Muchas gracias por su presencia en el primer webinar, doctor. Un saludo, por favor, para despedirnos.
Muchas gracias. Hasta luego.
Por favor, doctor, muchas gracias. Bueno, amigos, de verdad, magistral esta clase que nos acaba de dar el doctor Ethan Russo. Yo estoy acá todavía como anonadado. Importantísimo la importancia o la relevancia que haya una figura como el doctor Ethan Russo en la medicina veterinaria cannabinoide, por eso nos regaló su tiempo hoy en este espacio. Muchísimas gracias a todos los que han estado presentes. Bueno, no sé, estoy todavía un poco como flipando con esto, pero les agradezco mucho por estar acá, por haber estado presentes en la primera sesión de este webinar. No despedirnos sin antes recordarles que el día de mañana vamos a tener una sesión también cargada de buenísimos invitados. Vamos a tener a la doctora Ana Lucía Preciado de Perú contándonos acerca de una encuesta que hemos realizado de la mano de la Asociación Peruana de Medicina Cannabinoide, acerca de cómo nosotros como asociación y la Asociación Peruana estamos observando el panorama y pues tenerlo como un marco de referencia para ver cómo podemos seguir creciendo y evolucionando. Mañana también vamos a tener al doctor Fabio Mercante, al doctor Pet Cannabis, así como el doctor Eric, que es una figura muy importante en Brasil que trae una experiencia muy amplia, ¿ok? Para nosotros. Vamos a estar con la doctora Fabiana Landoni representando a Argentina con su investigación, que pues es otra investigadora así de talla mundial y se está dedicando ahorita de lleno al estudio del cannabis en los animales. Y vamos a terminar del día de mañana eh, nuestro webinar con la doctora Sara Silcox, que ella es la presidenta de la Asociación de Medicina Veterinaria Cannabinoide de Canadá, y nos va a contar cómo ha sido la experiencia de la asociación en el trasfondo social que tiene la legalización y cómo ellos implementaron el cannabis medicinal en la práctica clínica. Entonces, pues no siendo más, les agradezco nuevamente a todos por estar acá. Nos vemos mañana a las 5 en punto de la tarde para dar inicio al webinar y pues me despido agradeciendo nuevamente a las personas que nos están apoyando en la realización de este evento, a la Asociación de Medicina Veterinaria Cannabinoide de Canadá, a la Society of Cannabis Clinicians Capítulo Colombia, a la FES Cuatitlán, a la Facultad de Estudios Superiores Cuatitlán Universidad Autónoma de México, a CBD Pets Perú y a Tercan también por estar presentes acá. Muchísimas gracias y nos vemos mañana, amigos. Buenas noches.